Hey, it's Sneaky Joe DiBiase, one of the men of WGR. We're here with our partners from Roswell Park. April is Young Adult and Testicular Cancer Awareness Month. Here at Tees and Taps on Hurdle Avenue, I'm gonna sit down with my buddy Nate Geary, talk about his experience, get some swings in, and show him how it's done. What's up, buddy?
What's up, man?
Get some of the rust off?
Never rusty. I like they got clubs here.
Simulator putting.
What's your best club?
I think 7-iron. That might have to go.
All right.
Wow.
Love a good peninsula.
Wow. So thanks for doing this. It's
My pleasure, man.
It's a great time to do it. April is Young Adult and Testicular Cancer Awareness Month. Roswell Park, our partners, I feel like it was a good time to bring up your experience and what you went through when you had cancer.
Yeah, it was 8 years in February.
Yeah, 8 years since you were diagnosed?
Yeah, since I was diagnosed.
What about that experience, like the first time that you found out? I mean, I have to think, how old are you at that point? You're 20?
I was 24 years old, going to be 25.
Okay.
Yeah, so I was, young man.
So completely out of left field?
It's funny, I probably went to some combination of, my primary doctor and, name your local, immediate care center.
Yeah.
About 4 times with pain symptoms. And got sent home all 4 times. I thought the pain that I was experiencing from looking up online, because you're gonna self-diagnose yourself,
yeah.
Could be gallbladder. Maybe it's, I need to get my appendix taken out.
Because to you, at your age, you're not thinking about cancer at all.
No, cancer didn't even, the word cancer didn't even approach my vocabulary until it was told to me by my doctor. The moment I got to actually meet my urologist and speak to the doctor, it was very little time between handshake and you have testicular cancer. So literally from a normal 5-day business week for people, starts with, finally having the courage to say, I'm going to the hospital, to diagnosis, to we're getting you into the emergency room, into the surgery room on Friday.
Yeah.
It was a whirlwind week for me, no doubt.
So that's the first step of treatment. So I don't know how much we've ever got into this. Your treatment is the surgery, and then what came
Yeah,
after
so,
that?
and Roswell didn't come into the picture until post-surgery. I think the cool part about where that journey started at Roswell was having a doctor in Ellis Levine who, we went in and I'm thinking to myself, okay, I want the best. When I was introduced to my doctor, the first thing I did, it was kind of like, hey, who's this doctor? Going to Google and realizing that I'm working with here in Buffalo, literally the renowned guy for this type of cancer.
What about after you've been diagnosed, you're going through it, especially, mentally, any advice for, once you've been diagnosed and now you're going through treatment even, it depends on the level of treatment that you're getting, I'm sure, but the mental toll that it would take on someone in their 20s.
The sooner you can sort of move away from the victimhood of it to the ownership of it, which is, I'm gonna do whatever it takes to get to the other side of this. And when you can kind of transition your mindset from, this is the worst thing that's ever happened to me, to this is the best opportunity I have to change my lifestyle, to learn more about my body and how I'm reacting to things.
So how long did that whole process take?
Start to finish, I spent about 5 years walking in and out of the doors of Roswell. Got to the 5-year mark and it was like, hey, this is something we can really kind of do bi-yearly just for making sure everything's good.
And that's what you're doing now?
That's what I'm doing now, yeah.
For anybody that is, especially a young adult, isn't thinking about this at all, and then bam, they're going through it, what would be the best, advice, wisdom that you would give to them? Loaded question, I know.
Put aside the pride a little bit. Have open dialogue with your primary physician, but be open to, hey, I don't like the answers, continue exploring. Self-exams, educating yourself on kind of how to be proactive about it, to me is the best measure anybody can take. And especially, I didn't know that young men were the highest risk group for testicular cancer. To me, it's that's an old man cancer. That's not something young men deal with. Any opportunity that a young person, somebody in their 20s can take to make sure that the thing that they're worried about gets talked about with somebody, I think is super important. You know, if I could talk to the 24 old version of myself, it would be that I did a lot right and didn't know exactly at the time I was doing it right.
Yeah. All right, want to get back at it? Get some swings in again?
Yeah, someone's got to beat you.
Thanks for watching. If you are someone in your 20s or 30s and you want to learn more about your cancer risk, you could go to roswellpark.org/youngadult. I'm gonna get back though to beating this guy out on the course.